Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of the NAAOP. I have two things to relate this month. The first involves a policy victory, and the second relates to the Orthotic and Prosthetic Policy Forum. As to the policy victory, last month I reported that that proposed regulations had been issued that created a separate definition of orthotics and prosthetics in a document called the Uniform Glossary of Terms and the Summary of Benefits and Coverage. The Uniform Glossary of Terms is a document that lists a series of different medical terms and insurance terms, and it's written for lay people to be able to look at insurance plans and compare and contrast what plans cover and what benefit terms mean. For a few years now, we've been advocating that the term orthotics and prosthetics should be separately defined from durable medical equipment, and yet they have not yet taken that step forward. Just a month and a half ago, the three federal departments, the Treasury Department, the Labor Department, and the Department of Health and Human Services, issued joint regulations that would create a separate definition of orthotics and prosthetics, broken away and not included under the DME benefit. That was a really important victory and something that we believe is going to help define O&P care much more clearly to the general public as they look through their insurance policies and try to figure out what's covered and what's not. Now, just because O&P is covered or is listed separately in the Uniform Glossary of Terms, it does not mean that orthotics and prosthetics is covered without exception in all private health plans. But it will educate the public to what orthotics and prosthetics is, and will alert them to ask more questions about what may or may not be covered. The one thing that really clearly is established by this separate definition, number one, is that they're treating orthotics and prosthetics differently from DME, as the O&P field has long sought. But the second is that DME restrictions or restrictions in benefits or caps in coverage that may apply to durable medical equipment really cannot apply to orthotics and prosthetics going forward in private insurance plans. The second thing I wanted to mention was the O&P Policy Forum. This annual event is spearheaded by AOPA, as it will be again this year. It's a very important event. It brings together the orthotic and prosthetic community to Washington, D.C. to not only learn about policy and all of the things that impact this field and this profession, but also to galvanize support for the policies that will assist us and to go to Capitol Hill and actually make the case to lawmakers. This year we're honored to have former Senator Bob Kerrey, an amputee himself and user of a prosthesis, lead what we're calling an O&P Policy Congress, which will allow the community to come together and to draft legislation that we believe will significantly advance the field. Senator Kerrey is not only scheduled to lead this Congress, but then also do some specific meetings with key senators and congressmen on Capitol Hill. It's a tremendous opportunity to advance the field. We hope very much that you'll attend. Bob Kerrey's been a friend of O&P for years and years. George Brees and I recall working on his campaign back in 1992, and he's volunteering his services to come and lead the field in advancing the policies that will benefit us all. We hope you'll attend. The date is April 26th and 7th. You need to be here by Tuesday morning, the 26th. It's a very important event for the O&P community, and we hope that you'll make all efforts possible to try to get to Washington on that date. See you in a few weeks. Thanks so much.